YouTubers. I hope you are well, and I hope you're watching this video in good spirits. I came across a fellow YouTuber's video titled Phantom Kicks or Pregnant Again by Samantha M, and I think she explains this so perfectly that I had to feature her in this video versus summing up what she says. So thank you, Samantha M.
Negative. So I was not pregnant. I am not pregnant, thank God, like I said. But according to a doctor, what happens is our stomach muscles get kind of loose or whatever. So they're kind of like muscle spasms because of our minds getting so used to baby movements. The first thing that we think about is, oh, it's a baby, or we think it's baby movements, or sometimes it's gas. And the first thing that we think about is just like our mind just goes straight to thinking it's a baby. So that's what's going on.
All right, so thank you again, Samantha M. In this video, we will be covering the misconceptions of Doppler use in the cryptic pregnancy community, and how a Doppler works in general, and how it works in confirming pregnancy. But before we do that, I wanted to reiterate the definition of a real cryptic pregnancy and break down the magical pregnancy the Deluded Cryptic Pregnancy Community created and believes in. A real cryptic pregnancy is when a woman doesn't find out she is pregnant until she is 20 weeks or more. The woman produces little to slow rising HCG, and so the pregnancy can go undetected for months and can possibly even go unconfirmed the entire 9 months until the woman delivers. It is possible for the expecting mother to continue to have monthly cycles during the 40-week gestation period. However, the terminology, quote-unquote, cryptic pregnancy has been linked to mythical signs and symptoms such as a slow-growing baby, times when the baby stops growing altogether for days, weeks, or even months at a time, a tilted uterus making the fundus or the top of the uterus, the growing uterus, hard to find the entire length of the pregnancy, a baby that hides or is undetectable during an ultrasound, a baby that hides behind intestines or swims away from the ultrasound or Doppler, making itself, quote-unquote, unseen or quote-unquote seen when and if it wants to. Baby movement seen from the outside of the mother's belly is lacking the definition of arms, legs, butt, back, head, feet, and hands. Finding a fetal heartbeat in areas other than the lower abdominal region of the mother. Pregnancy that lasts 2 to 5 years, a pregnancy that will go unconfirmed due to a negative urine pregnancy test, blood pregnancy test, a negative ultrasound, a pregnancy that allows you to continue to ovulate, and a pregnancy that defies the body's natural process in conception and fertility. In reality, the science does not support a baby beginning the first stages of life and then going into almost a hibernation where they stop growing or begin growing slowly as a way of surviving. This is not how the body works. If there is a problem, big or small, with any pregnancy, the body aborts to save resources, ultimately preserving the woman's fertility. It is basic survival instinct and the only way the body works. Not one scientific study or medical study supports a half-grown baby suddenly having to stop growing for a set amount of days and then being able to start growing again. It is not possible and not the way DNA and gene production work. So now that we recovered that, let's go ahead and take a good hard look at the misconceptions of Doppler use. Dopplers have been used to confirm pregnancies in the past by midwives, obstetricians, or medical doctors. These are trained professionals making these diagnoses, and the heartbeat is usually confirmed by more than one professional. Let's first cover some very important notes about Dopplers. The very important note number 1 is the placement of the probe. A fetal heartbeat will only be found farther down on the abdomen in the early stages of pregnancy. You are likely to find it low by the pubic bone, and then as the uterus grows up out of the pelvis, it is found closer to the belly button. And then in the later stages of pregnancy, it is easiest to find when adjusted to baby's position. By 34 weeks, a very noticeable fundus will be found, and the baby's body becomes very apparent and can be easily palpated. The Doppler probe can be easily customized to the baby's position to find the best and clearest heartbeat. A fetal heartbeat cannot be diagnosed if found on the chest, under the breasts, or high by the ribs. This is the mother's heartbeat. The Dopplers very easily pick up sounds of your bowels and air moving through your intestines. It is very easily picks up all kinds of noises in the body. So something also worth noting about fetal Dopplers is that they do take some time to detect a fetal heartbeat, even if they are being used by a professional. To the untrained ear, it is very possible to mistake the mother's heartbeat for the baby's. It is therefore important to note that a baby's heartbeat, a baby's heartbeat is much faster than that of an adult and ranges somewhere between 120 to 160 beats per minute. It is commonly likened to the sound that is made by a galloping horse. To give you some extra level of reassurance that the sound you are picking up is baby's and not the mother's, is to manually count the heartbeat being heard and cross-check it with the results displayed on the Doppler display screen. In the early stages of pregnancy, like stated before, when using the fetal Doppler, it should be placed close to where the pubic bone is located. And you should apply some jelly about the size of a pinky rounded portion on the stomach. You should take your time when looking for the baby's heartbeat, as it is sometimes difficult to detect, so you should keep trying for several minutes on some occasions. The device should be used down to the pubic area up to where the bikini line is and around the belly area. It is advised that if you've had a C-section, you should place the Doppler onto the area where the C-section incision is located. Scar tissue from a C-section or surgery in that area can also make it difficult to interpret sound heard. It can muffle and distort the sound when returning it to the transducer. Also, it is important to note the type of Doppler you are using, as the 3 MHz probe is more sensitive than the 2 MHz probe. The 2 MHz probe, which is designed to accommodate late-term and obese pregnancies, occurs as it was designed to operate at larger depths but works best at a depth of 10 centimeters. When it comes to pick up the fetal heart rate at an earlier pregnancy date of between 8 to 10 weeks, the 3 MHz probe that is more sensitive than the 2 MHz probe is more suitable. Illness and diseases that interrupt Doppler interpretations are digestive disorders such as irritable bowel syndrome, IBS, lactose intolerance, peptic ulcers in the small intestines, reflux disease, gallstones, diverticulitis, Crohn's disease or ulcerative colitis, celiac disease, constipation, and intestinal parasites. Yes? Oh, there's no more? 1 second. Okay, I'm back. I'm pretty sure I left off at celiac disease, constipation, and intestinal parasites. So I wanted to quickly cover diverticulitis. It's abnormal bulges called diverticula somewhere in the wall of their intestinal tract. Yet only 20% will ever experience a complication such as diverticulitis. So a lot of people have abnormal bulges in their inside their intestinal tract. And so your intestines move around. They move around in order to pass your feces through them. So they are able to, because they're moving around, they can get, small weak spots, and that can cause abnormal bulges. So some of the movement you are feeling could be because you have diverticula. Wanted to quickly cover Crohn's disease and ulcerative colitis. May arise from a wayward immune system that leads the body to attack the gastrointestinal tract. Crohn's involves ulcers that may burrow deep into the tissue lining at any portion of the GI tract, leading to infection and thickening of the intestinal wall and blockages that need surgery. Ulcerative colitis by contrast, afflicts only the colon and rectum, where it also causes ulcers. Colitis is characterized by bleeding and pus. So it could be that you're developing one of these complications. Celiac disease, or what a lot of people know as being allergic to gluten. Gluten is a protein found in rye, barley, wheat, and more without triggering an attack on their small intestine. Symptoms vary from person to person, but include abdominal pain and bloating, chronic diarrhea, vomiting, constipation, impale, foul, smelling, or fatty stool. Doctors typically diagnose it with blood tests and stool samples. So these are some of the digestive disorders that can make it hard for you to interpret. They can interrupt in Doppler interpretation. So what you are thinking is a heartbeat is actually just your intestines. And then I wanted to quickly cover heart disease that can affect the interpretation of a fetal heartbeat using a fetal Doppler. Heart disease describes a range of conditions that affect your heart. Disease under the heart disease umbrella include blood vessel diseases such as coronary artery disease, heart rhythm problems, arrhythmias, or heart defects you're born with, such as congenital heart defects. A lot of people who are born with congenital heart defects are not diagnosed. Usually they are not diagnosed until something goes wrong. And then just having an untrained ear can make you more susceptible to misinterpretations and confusion. It takes years of training to be able to use a handheld Doppler with complete reassurance in the medical setting. Ultrasound gel is imperative when doing an exam with a fetal Doppler. Ultrasound gel is specifically formulated to act as a coupling agent and reduce static that is often caused when using a fetal Doppler. To get optimal use and sound out of a fetal Doppler monitor, use plenty of gel. Do not use colored gels or lotions. Any oil-based substance used with a fetal Doppler will cause excess static and damage to the Doppler probe, making it hard to distinguish sounds heard from the body and making the Doppler probe unreliable because of possible damage. So that is covering Dopplers. I hope this video helped somebody. Next video I will be covering ultrasounds. If you like this video, please give it a thumbs up. If you want to see more videos, don't forget to subscribe. Thank you guys for watching and have a great day. Bye.